And then you see this septal tubercle here. Sometimes you call it a septal turbinate, which is similar to your turbinates. Okay, it contains venous plexuses, which are actually pseudo-erectile tissue. Okay, under the control of your autonomic nervous system. So sometimes when you look inside the nose, you'll see, oh, may septal deviation, but it's not actually a septal deviation. You just caught it at the time when the septal tubercle is congested. Right? So it's very important to decongest the nose before you can say that it's really a true septal deviation. Because many times what you see is a septal tubercle. Okay? A congest. So like your turbinates, they also congest and decongest. So next slide, please. So you see the big jump. You see the big jump from that area to this one, because it's a variable slice thickness. Because we want to concentrate on the all-important osteomeatal complex. So if you see here now, okay, so you see let's look at the obvious ones first. You see the orbit, okay. You see again here the perpendicular plate of your ethmoid, which is your bony septum. You see the septal tubercle here. You see here the anterior nasal spine, and of course you have your piriform aperture. Now you're already beginning to see the maxillary sinus. Now let's concentrate on the lateral wall. So you see here a pneumatized cell in the lateral wall. Agree? Okay. You see the beginnings of your what turbinate? Middle, because that is the inferior. Alright. Now you can see a pneumatized cell here on the lateral wall. So the rule is, the first pneumatized cell that you see on the lateral nasal wall, before you see the middle turbinate in its entirety, is what cell? Agarnazi cell, which is practically present in about 100%. Of course, it may be huge, it may be small, but it's practically present. When you do cadaver dissections, it's practically there. Okay? So it's very important to know that, because so sometimes when you use a variable slice thickness, it's very important to understand the relationships, to know where you are. Diba? That's why the coronal section is very easy. So if you look at it this way, if this is the Agarnazi cell, what are its relations? You know that anterior to the Agarnazi cell is a thick bone, which was backwards. Which is that. Diba? Bago lumabas yung cell, diba ito muna nakita nyo? So what is that? That's the frontal process of your maxillary bone. Now go back. So that's the anterior relation. As you go, diba? That's why when you see it in succession. Okay. Now, laterally, this is the relation. What is this? This is your lacrimal fossa. Okay. So the lateral wall of your Agarnazi is also the medial wall of your lacrimal fossa. Understand? See? So, yun importante. So, when people ask you, what is this cell? It's not enough to memorize it. It's important. The only way that you get it is to see the relations. Di ba? To see the relations. So if that is the Agarnazi, anteriorly it is anterior. You saw the thick bone of the frontal prosomaxillary bone. Laterally, you have the lacrimal fossa right here, okay? Anterolaterally here, frontal prosomaxilla. And then inferomedially, it will be the beginning of your uncinate process. Okay? Uncinate process right here. Okay? And then superiorly, so if this is the Agarnazi, what would be the space above the Agarnazi? Frontal. It will be the frontal recess, frontal sinus ostium complex. The frontal sinus outflow tract. Diba? Remember, the frontal sinus outflow tract is described as what? Hourglass shaped. Diba? The upper flare of the hourglass corresponds to the sinus. The waist corresponds to the ostium. The lower flare corresponds to the frontal recess. So alam mo na ang relation nito Agarnazi. If there's a space, that must be the frontal recess. You see, that pinch there, that narrowing there must be the frontal sinus ostium. Okay? Okay, so, dito, if you notice, kita na kaagad yung middle turbinate. So you might say, baka ethmoid pula yan. Kasi nakita mo na yung middle turbinate. But you don't see it yet in its entirety. Do you agree? Normally, you don't see this. Normally, you don't see that. You just see that, so it's easy to know. But by knowing the relationships, because you still have your lacrimal fossa here, you know that that's an Agarnase cell. Okay? Which is the most anterior ethmoidal cell. Okay? At radiologically, that's the first thing you see. Because that's the first pneumatized cell that you see on the lateral nasal wall. Okay? So, anteriorly, it's the frontal process maxilla. So, sa likod yan, what would it be? It would be your infundibulum, the drainage. Superiorly, frontal recess. Inferior and medially would be what? The uncinate process. Okay? Agree? Uncinate process. Next slide, please. So again, okay? Anterior cranial fossa, got your orbit here, middle turbinate, inferior turbinate, septal tubercle, what is this? Perpendicular plate of your ethmoid, alright, maxillary crest, anterior nasal spine, right? Sinus is there, maxillary sinus. What is that cell? What's it? Agarnase pa rin. Why? You want to look at your relationships. What is this? That is the lacrimal fossa. What does it carry? Lacrimal duct. You can see it along this bone. Diba? Nasolacrimal duct. It goes down here along the lacrimal process of your inferior turbinate. Okay? And where does it exit? What's that? In the inferior meatus, which is protected by a valve called Asner's valve. Okay? So it's about 3 from the nasal sill, from the opening, you can locate it right there, high up into the inferior meatus. Okay? So alam mo, ano yung cell na yan? Agarnase yan. Diba? Bakit? Kasi, nandyan pa yung nasolacrimal duct mo. So this one should be your part, the beginning of your uncinate process, di ba? That's why pag nag-uncinectomy ka, you actually opening already the inferomedial aspect of your Agarnase. That means if you carry it all the way up, kung nag-uncinectomy ka, di ba? Binubuksan mo na actually yung Agarnase cell. Kasi inferomedial border niya is that eh. Okay? So what is the airspace above it? Frontal recess. As you can see, dito sa kabila, frontal recess, and then you have the narrowing, which should correspond to the ostium, the waist. And then you have your you have the frontal sinus after that. See, I'm taking it kasi one slide at a time, but you know, when you see that whole plate there in front of you, masusunod mo talaga. So, yung frontal sinus, chuk, 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 di ba? Sunod-sunod yan. Okay? So, that is now so the skull base is now becoming more apparent. But wag muna natin pag-usapan yan, but it's now beginning to, the anterior skull base is now beginning to become more apparent. So, that's the frontal sinus. Next slide, please. Here, okay. So again, orbit, brain, septum, tubercle, ear turbinate. What is that cell? Meron ka pa bang nasolacrimal? Look at that. Yes, diba? You see this? Okay, so that is still your Agarnase. And then you see here, what is that? Malaking Agarnase nitong patient na to. So you can see here that there is the inferomedial aspect would be the part of the uncinate. So remember, the problem with a variable slice thickness like this is it's very difficult for you to understand where the agar nasi ends and which is the next ethmoidal cell that you're looking for. Bula. Understand? So, the problem with the variable slice thickness is that you don't know where it ends, when the agar nasi ends, and when the anterior ethmoidal bula begins because malaki yung jump. But by knowing the relations, madali mong malalaman. Diba? Okay? So, that's your inferior turbinate. You can see here very clearly your nasolacrimal duct is still trying to drain there. Okay? From the, in the Hasner's valve, protected with the Hasner's valve in the inferior meatus. Okay? So that should still be your frontal. Okay? Recess. Next slide. Okay. Now it's a different story. We jump again. Have the same thing. You have the orbit, brain, septum, septal tubercle, inferior turbinate. Now, what is that cell? Huh? What is that cell now? Okay. What is this? So what do you see that? What's that cell now? Exactly. So it's a bula ethmoidalis already. Why? Do you still see your nasolacrimal fossa? Wala na, lamina na yan. It's the lamina papyracea already. Okay? You can see that hiwalay na. Diba? Is your uncinate attached to your bula? Of course not. But is your uncinate attached to your agar nasi? It is. Where? In the inferior medial aspect. Agree? Diba? Madali lang eh. Yan. So there. So that's your bula right there. Bula ethmoidalis, uncinate process. So you've already seen the first lamella, second lamella. So may utang na lang akong dalawa lamella. Okay. Now, you can now see the skull base here. If you see the skull base here, so you can see how sharp it is. You have your crista galli, you have your bone here, cribriform plate, and then you have the lateral lamella of your cribriform plate, which again articulates with a thicker bone, the fovea ethmoidalis of your frontal bone. Agree? The fovea ethmoidalis of your frontal bone. So that is the roof of your ethmoid. Diba? That's the roof of your ethmoid. But this one is your skull base. So you have a medially located cribriform plate and a laterally located fovea ethmoidalis of the frontal bone. Okay? So if this is now the ethmoid bula, ano ngayon ang relations niya? What would be the cell above it, this space? Kanina, agar nasi, ano yung nasa taas niya? Ngayon, nasa bula ka, anong space sa taas niya? Suprabular recess. Suprabular recess. So if your ethmoid bula is very well developed, and it reaches all the way to the fovea ethmoidalis, to the roof of the ethmoid, meron ka bang suprabular recess? Hindi, wala. Diba? So now, imagine it. Think of the slice anteriorly. So you can see that, yung agar, yung frontal sinus pala, yung frontal recess pala, continuous dito sa suprabular recess. Di ba? Totoo. Think of it. Di ba? Yung space na yan, kung sundan mo yan, doon sa mga, sa slice ahead of it, that will still be your frontal recess. Di ba? So, but continue siya. So that's the suprabular recess. Now, behind the bula, between the ground lamella, which is your third lamella of the primary, and the bula would be what? It will be a retrobular recess. Alright? Retrobular recess. Collectively, the suprabular recess and the retrobular recess are called what? Sinus lateralis. Okay? And we will go back to that later on. So, alam na natin yan yung cell. Ito yung uncinate process mo. Now, the uncinate process has a variable attachment superiorly. Importante yan. Yung superior attachment na, pinakita ba sa inyo ni Dr. Matubis, where it can be attached? It can be attached directly into the skull base. It can be attached to the lateral surface of your middle turbinate, or it can be attached directly into your lamina papyricia. Yun yung superior attachment. The antero-superior attachment of your uncinate is variable. Pinakita ba yun ni Jake? Okay? Na pwedeng umakyat doon, pwede dito, pwede diretso doon. Why is that very important? Because it determines the drainage of your frontal sinus. Diba? If your uncinate process attaches directly to the skull base, then what happens? It will drain medial, it will drain lateral to the uncinate process directly into the infundibulum. Ganun din if the uncinate is attached to the middle turbinate, diretso sa infundibulum. But if it is attached to the lamina papyricia, then it drains now medial to the uncinate process into the meatus. Diba? Hindi sa infundibulum. So that's very important. But the lower part, kasi remember it's sickle-shaped. So the postero-inferior part, ang attachment niyan is mas predictable, mas consistent. The inferomedial part is usually attached to the ethmoidal process of your inferior turbinate, and then posteriorly to the perpendicular plate of your palatine bone. Kaya yun ang pinakamahirap hiwain, di ba, when you do your uncinectomy. It's at this area where it attaches to the ethmoidal process of the inferior turbinate, and then more posteriorly to the perpendicular plate of the ethmoid. Papakita ko yan mamaya. Next slide. Is that the next? Okay. So you can see, when it came to the osteomeatal complex, dikit-dikit na tayo. Di ba? Kanina, ang laki ng talon. So, same thing, no? You have your turbinate, maxillary sinus, infraorbital nerve, orbit, skull base, okay? Skull base, roof of the ethmoid, fovea ethmoidalis, di ba? And this is the lateral lamella of the cribriform, and then that's the crista galli. Middle turbinate is here. This is the uncinate process. So this is the ethmoidal bulla. You have the lamina papyricia, suprabular recess. Okay. So if you notice here, okay, anterior and inferior to it would be this uncinate process. I told you that the attachment superiorly is variable. So if you look at this, between the bulla and the posterior free edge of your uncinate process is a two-dimensional opening, which is called hiatus semilunaris inferioris, which leads to a three-dimensional opening here called the infundibulum. Okay? And then leads to the maxillary sinus ostium. Okay. Actually, the infundibulum is where all this anterior group of sinuses drain. The frontal, the anterior ethmoids, and the maxillary sinus. It's in the infundibulum. So, yun ang tatandaan nyo. A two-dimensional space, hiatus semilunaris inferioris, opens into a three-dimensional space, the infundibulum. Okay? So when you do your uncinectomy, you are already doing your infundibulotomy, because you're actually opening the medial boundary of your infundibulum. The lateral boundary of your infundibulum would be this. What's this? That's your lamina. Diba? The medial boundary would be this, which is your uncinect. So when you do your uncinectomy, infundibulotomy na rin yan. Diba? And like what I said, if you carry it all the way up, you probably will also open the inferomedial aspect of your agar nascent. Okay. Now, so I forgot something about agar. Can you bring it back just briefly? You know, when you do your, that's why it's important to know the agar nasi. Harap ng harap. Sige pa. Sige pa. Yeah. Okay. There. You know, we always do, when we do endoscopic dacryocysto-rhinoscopy, okay, endoscopic DCR, diba? You have to bypass, diba, the blocked nasolacrimal duct here, diba, by creating an opening directly from the sac, from the nasolacrimal sac into the nose. So if you notice, if you do an endoscopic dacryocysto-rhinoscopy, you have to understand that you will have to pass through the agar nasi, diba? Because sabi ko sa'yo, the lateral wall of the agar nasi is also the medial wall of the fossa. So yung iba dyan kasi, pagpasok dito, akala nila ito na yun. But you have to understand that you still have another wall, which is this one, to penetrate, to be able to do your dacryocysto-rhinoscopy. Alright? So I just wanted to show those are just the extended, the next back to the. Okay? So clear? So, now, if you have a hiatus semilunaris inferioris, then you have a hiatus semilunaris superioris. And the hiatus semilunaris superioris, just like the inferioris, is also a two-dimensional opening between the middle turbinate and the bulla, right there, which leads again into a three-dimensional space called the sinus lateralis, okay, which is made up of your suprabular and retrobullar recess. So in other words, if your access to the infundibulum, a three-dimensional space, is through the inferioris, your access to a three-dimensional space, which is the sinus lateralis, is through the hiatus semilunaris superioris. Is that clear? Okay, next slide. Okay, so nakita na natin, this is the first lamella of your middle turbinate. I forgot to tell you. Kita pa rin naman dito. As you can see, the first lamella is attached to just across the lateral lamella of the cribriform plate. Agree? So that's your first lamella. So you know, if you are in the first lamella of your middle turbinate, you must be the anterior third of the nose. If you are in the middle lamella, the oblique lamella, you must be in the middle third. And if you're in the horizontal lamella, you must be in your posterior third. So it's a rough guide, no, of knowing where you are, especially when you're looking at the scan. Alam mo saan hahanapin. Okay. So this is definitely the vertical lamella. You see that the skull base is still sharp. Okay. You have here your anterior, your ethmoidal bulla, hiatus semilunaris inferioris, infundibulum, and the maxillary sinus, turbinates, septum. Right? Now, suprabular recess. Agree? Okay. So what's unique about this scan in this patient is that you see this. What is that? Anong area ka ba rito? What area are you in? Anterior ethmoid? Posterior ethmoid? Ha? Bakit? Alam mo anterior ethmoid kasi nasa first lamella ka pala. Diba? Saan ang posterior ethmoid mo? Diba sa likod ng ground lamella, which is your second lamella. Eh wala ka pa dun eh. Diba? You're not there. You're in your first lamella. So you know your anterior ethmoid. So if you see your anterior ethmoid and you see this, what should that be? What's that? This is the orbit. This is the anterior cranial fossa. So this is the orbitocranial canal, which transmits what artery? Because you are where? You are in the anterior group of cells, di ba? Okay? Alam mo. So there. This is very unusual because normally it hugs it there, along the skull base, along the fovea, the dome, along the roof of the ethmoid. Ito, it's hanging by a mesentery, as you can see. So always be cognizant of that. So if you notice here, the anterior ethmoidal artery starts from the orbitocranial canal, or from the orbit, and then it passes the orbitocranial canal and enters at the junction of which one? The fovea and the lateral lamella. That's why, di ba, sabi natin, yan ang weakest point in the entire skull base. The weakest point is the junction of the fovea, thick fovea, and the lateral lamella. For what reason? Because it is perforated or penetrated by the orbitocranial canal. Okay? So, if this is 0.5 millimeters in thickness and the lateral lamella is 0.2 millimeters and this is 0.5, okay? Yung area na yan, kung saan pumapasok yung orbitocranial canal in that skull base, in that junction, that's only about 0.05. So it's about 1/10. It's about 1/10 the thickness of this one. So talagang when you're working in this area, you better be careful. You don't want to stay too medial because this is where you can cause the leak. And ito, worse pa to because if you hit this, magre-retract yan. And it can lead to a retrobulbar hematoma. No? So this is unusual because normally it hugs the dome of the roof, no? Hindi mo nakikita. And your only inkling as to the position of the anterior ethmoidal artery, your only inkling is that you will see a nipple. See that nipple right there? A nipple on the lamina papyracea. Hindi mo makikita yung kanal, makikita mo lang may nipple at the junction of your superior oblique muscle here and the medial rectus muscle. You will see that. Sasabihin mo, nandyan ang anterior ethmoidal artery. Okay? It's always there at the junction. You see this? That's the oblique, superior oblique, medial rectus. At the junction, may nipple yan, which marks the site of your anterior ethmoidal artery. Your posterior ethmoidal artery may be absent in about 1/3 of patients. So, hindi consistent. But the anterior ethmoidal artery is always there. So, ito na yung ano mo, bulla suprabular recess. Next slide. Okay, so this is the lamella. Tama? Vertical pa ba? Vertical. Pero nakikita mo to, saan papunta to? Anong shape nito? Papunta saan? Pa-oblique na. So ano to? Ethmoid. Anterior ethmoid pa rin. This is your uncinate process. As I said, when it's downward slope, in its downward movement, you can see that it attaches to the ethmoidal process of your inferior turbinate. And that's your septum. Lamina papyracea is your suprabular recess. So ano yan? Orbitocranial canal. Cranium. Orbitocranial canal, which transmits the anterior ethmoidal artery. Agree? Skull base is still sharp. Okay? So nasa harap pa tayo. Lamella is still vertical. So nasa anterior ka pa. Agree? Next. See? When it gets to the osteomeatal complex, dikit-dikit. So it's basically the same. You have the uncinate, you have the sharp anterior cranial skull base there. This side, you can see the vertical lamella is still attached directly across the lateral lamella, but it is now transitioning into the second lamella. And what is the direction? Oblique. Saan pupunta yan? Dito. Namin na. Tingnan mo yung nipple na sinasabi. Kung wala yung kanal na yan, di ba magiging nipple lang yan? Di ba? Kung wala yan. Di ba nipple? Di ba? Ang nipple yan, ano yung muscle na yan? Ano yung muscle na yan? Sa junction yan, nandyan ang nipple. So, minsan wala kasing mesentery. Ito kasi weird, but it's good. At least you can notice. That's why, if you do your ethmoidectomy, and you carry it too high, diba? That's why when you do your ethmoidectomy, anong turo sa'yo? You will see that in your cadaver. You stay anterior, of course, you stay medial, and you stay inferior. Diba? Because you don't wanna masyado kang taas mo yan, na tamaan mo yan. That's it. Diba? Magre-retract yan. So that's a superior oblique, medial rectus. Clear? Hiatus, bulla. Next. Okay, biglang talo na. Diba? Tapos na tayo sa osteometal complex. Kaya, variable slice, you jump. Okay, again, it was just for practicality reasons. So this is your middle turbinate. What is this? It's the remnant of uncinate process. Diba? Sabi siya, posteriorly, where will it attach? What is this? Palatine bone. Horizontal process of the palatine bone. What is this? Kung may horizontal, may perpendicular. Diba? So, diba sabi ko sa'yo, sa dulo, yun yung lagi nyung naiiwan pag nag-uncinectomy kasi ang tigas ng buto na yan. But it's consistent. Diba? It goes down, ethmoidal process of the inferior turbinate, then perpendicular plate of the palatine bone. So that's your posterior, pinaka-posterior inferior portion na yan. Kasi diba sickle? Ganon. So that is now your middle turbinate. Saan ang lamela niya ngayon? Yun. Isa. Dalawa. Anong shape? Anong direction? Oblique. So anong tawag mo doon? Ground lamela or lamela. So this cell here is still part of your ethmoid, anterior. Diba? Kasi beyond this will be your. So, yung na-promise ko sa inyo, nakita nyo na, yung skull base nagsisimula na mag-flatten. Agree? Alright? Yung second lamella, napakita ko na sa inyo. Okay? Second lamella ng middle turbinate, which is also the third primary lamella of the sinonasal canal. Agree? After the uncinate, the bulla, down lamella. Okay? So, clear na yan. Okay. Lumalabas na dito ang superior turbinate. Diba? May nakita ka na namang kanal doon. Nasaan ba tayo na yun? Anterior ethmoid o posterior ethmoid? Posterior na yan. Nandiyan ang middle. Diba? So ano yan? Anong artery yan? Posterior ethmoidal artery. Can you believe it in this patient? It's present and it's also low-lying, hanging. Okay? Ganun din. Pero bihira mo makita yung posterior yan. Kasi usually 1/3 of the time, wala yan. So that's your bulla here. That's your second lamella oblique attaching to the lamina papyricia. So you're now in the middle third of the nose, rough. Next slide. Remnant, perpendicular plate of your palatine bone. Do you agree, guys? Septum, your turbinate, middle turbinate, attaching to the lamina papyricia, flattened, thickened skull base. Agree? Okay. If you look at the orientation of your middle turbinate right here, saan na siya papunta? Anong shape ng gusto niyang gawin? Kaya lang pneumatize eh. Pneumatize. Pero anong direksyon na ng kanyang posisyon? Ganito ba? Ganito ba? O ganito? What do you call that direction? Horizontal, di ba? So alam mo, roughly, you're already in the posterior third. Okay, posterior third. And where should this attach? If the first attaches to the lateral lamella directly across of the cribriform, the second attached to the lamina, where should this attach? Which is this one. Agree? Which is this one. Hindi mo pa nakikita, but it is that one. And that, again, as I told you, is the posterior most area. The posterior most and the inferior most area of your uncinate process. Agree? So lamina, skull base is flat. Next slide, please. Okay. Anong lamella yan? Horizontal na. Okay. Flattened, thickened skull base. So na-promise ko na lahat sa inyo, ipapakita ko sa inyo. Yan. Okay. So yun, superior turbinate. So you expect the cells here, superior meatus would be the posterior ethmoidal cells. Diba? Diyan na yan, di ba? Okay? And this is your perpendicular plate of your ethmoid, of your perpendicular palatine bone, right here, maxillary sinus. Next slide. Same basically. No difference. Next slide. Okay, same, di ba? Nakakabit na. Kita mo yung uncinate mo. Halos wala na lang. It's just like a small dot, but skull base is flat. This is your posterior ethmoid complex in the superior meatus, superior turbinate. This is your bony septum. Next slide. Okay, so this is much clearer, di ba? Horizontal na talaga. This is your perpendicular plate. Skull base is there, and that is your superior turbinate together with your posterior ethmoid group of cells with your bony septum. Clear? So tapos na yan, di ba? Nakita na natin yan. Alright, next. Same. It's more it's really oriented. Almost wala nang uncinate. Okay, same. Next slide. Okay, now, so that's clear. If you're turbinate, horizontal process, clear na yung palatine bone, di ba? It's really bony na, di ba here? So that's really your horizontal lamella. Now, that's your skull base again. This is the problem now, see? So you see a pneumatized cell here. You see here definitely, which is the rostrum of your anterior sphenoid. So that is now your last lamella, last primary lamella, the sinonasal cavity. Uncinate, bulla, ground lamella, frontal sinus, sphenoid sinus, dito. And then you see this cell here. Okay. Ito ngayon ang tanong. That is the limitation of just having purely coronal section CT image. Because you do not know now, are you dealing with a large sphenoid sinus and a small on the left and large on the right, or are you dealing with a sphenoethmoidal cell, which is called the Onodi cell? An Onodi cell can actually grow superior and lateral to your sphenoid sinus. And it's very important to know that, because if you're going to do a transethmoidal, complete sphenoethmoidectomy, diba, you pass through the anterior ethmoid, ground lamella, posterior ethmoid, and then into the sphenoid. Pag hindi mo, if you're not aware or cognizant of the Onodi cell, you might actually injure, and as I will show you later, you might actually injure the optic nerve. Diba? So it's very important to know the Onodi cell, because para alam mo, oops, it's an Onodi cell, it's not yet a sphenoid, diba? So I have to stay medial to it, okay? So that's the problem. It's hard to say, are we dealing here with a large sphenoid on the right and a small sphenoid on the left, or are we dealing with an Onodi cell? Okay. That's why I included two axial views. Okay? So that can become, so we can explain it much better later on. Next slide. Next slide, please. Okay, here, again, diba? Definitely are you in your sphenoid, because you already see your anterior clinoid process. This is your cavernous area right here. Okay, so this one again is a question mark. Is this an Onodi cell? And this is just the sphenoid, agree?